Hello, Southern California. I'm Mike Lama, Senior Vice President for Development and Field Management for the American Foundation for Suicide Prevention. I want to thank you for participating in the SoCal Out of the Darkness experience. I'd also like to thank our hardworking staff and wonderful volunteers for working to put on the experience and leading the efforts to prevent suicide in Southern California every day. Even though we can't be together in person this year, we can still come together to fight suicide. Despite the pandemic, the life-saving work of AFSP continues. We are funding 38 new research studies, bringing our total investment in research to $20 million, making us the largest private funder of research. We have converted our education programs from in-person to virtual, reaching thousands of people with these much-needed programs during the pandemic. We continue to reach out and provide comfort and resources to those who've lost someone to suicide. We've been advocating for all communities, especially those where healthcare disparities exist. We're especially proud that two bills we championed here in California, SB 803 and 885, were passed and signed into law by Governor Newsom. Today we honor those we've lost to suicide and those who are struggling. By joining our nationwide movement, you are helping to raise awareness about this issue, provide healing and hope, and raising much needed funds to support the work of the American Foundation for Suicide Prevention. During the pandemic, our work is needed now more than ever. I look forward to seeing you again in person next year. Until then, stay safe and thanks again.
Hello, I'm Dr. Robin Henderson, and I'm a psychologist with Providence Health System. At Providence, we understand the impact the pandemic has had on our communities and on your mental health and wellness. And I'm here to tell you that you're not alone. Hope is not canceled. Hundreds of Providence caregivers and staff are joining the Out of the Darkness Walk. Our teams are made up of doctors, nurses, administrators, and mental health workers. We know the impact of suicide on our work in the front lines of healthcare, and we feel it personally too. We want our communities to know that they are never alone when dealing with suicide and mental illness. With 1 in 5 Americans impacted by mental health issues, Providence is forming partnerships to reach even more people before a crisis occurs. If you or someone you love needs help, please please look for community resources at providence.org. I invite everyone who cares about suicide to join us in coming out of the darkness and walk with us so that we can begin to heal. Thank you and be well.
It is my privilege to join you for this important and urgent cause. I'm Supervisor Catherine Barger, Chair of the Los Angeles County Board of Supervisors. I am proud to partner with the American Foundation for Suicide Prevention to end the stigma about suicide, advocate for our community members, and ultimately save lives. For people of all backgrounds and circumstances, suicide is a leading cause of non-natural death in Los Angeles County. Each life lost is a tremendous tragedy for the loved ones affected and for our entire community. Suicide can be prevented if we know the signs, find the words to talk openly about it, and encourage people who are struggling to reach out for support. I'm grateful to your organization for offering valuable education, awareness, and resources. When we look at the statistics, it's sobering to see that one person dies by suicide in California every 2 hours. These are more than numbers. These are precious lives and heartbroken loved ones they leave behind. All of us are facing immeasurable pressure and serious challenges. It's more important than ever to check in on one another. Just because we're a little farther apart doesn't mean we are disengaged. Let's all recommit ourselves to care for our friends and neighbors, reminding them that their lives are valuable and we're here to support them in their time of need. We all have a role to play in the fight against suicide. Mental health care matters, and every community member deserves compassionate, effective services. Thank you for leading the way in this effort and for galvanizing our residents to do their part. Together, we are making a difference and saving lives.
So, who is CalOptima? CalOptima is a community-based health plan helping low-income residents throughout Orange County. In total, we serve over 750,000 people from San Clemente to Seal Beach and all points in between. Our members include seniors and elders, people with disabilities, children in the foster care system, and low-income single men and women. But mostly, our members are made up of families like yours and mine, our friends and neighbors who need assistance through tough times. We provide our members with access to quality healthcare services so they can get the care they need when they need it, keeping them healthy and productive in the community, and preventing small and easily treatable healthcare problems from becoming big and expensive ones. So, who is CalOptima? We're all CalOptima, working better together to keep Orange County healthy and strong. CalOptima, keeping our community healthy today and in the future.
There are many individuals who are not getting the care that they need. And they're not getting the care for a whole host of reasons. Either it's not available, or it's not accessible, it might not be affordable, or it just may be unknown to individuals who are affected by this. Be Well Orange County is a movement. It's our community-wide strategy, our organized effort to create a system of care for mental illness to vastly improve the mental health of the people in this community.
We are very fortunate as a county to have a very efficient-minded government, both at the county and the city level, and also a very strong private sector.
Stakeholders that have an interest in mental health in Orange County, academic, hospitals, government, elected officials, the private sector, and we can all get moving in the same direction towards reaching a goal to leverage each other's efforts, learn from each other.
Bringing those people together requires some structure and some process. And the structures that we're putting in place include things like facilities, wellness hubs, clinicians providing the best care, world-class care for every person.
The needs do vary because of a very diverse county. Mental health starts with early childhood and goes right on up through adulthood. We want to be able to respond to all those needs.
This wonderful strategic initiative for the Mental Health Campus is a template that can be used throughout the state of California, but also across the United States. We're tackling this problem head on, so the timing couldn't be better.
We believe that Orange County can be the healthiest community in the United States as it relates to mental health, mental illness, and behavioral health issues. Be Well Orange County is our collective effort to make that happen.
I am spilt milk and a cookie batter thief. I am 3 feet 10, 4 feet 9, and 6 feet 1. I am a first kiss and the last to be picked. I am a monkey, a frog, and an entomologist. I am sticks, stones, and broken hearts. I am not a fan of bedtime or broccoli. I am lost and found. I am a gallant hero recovering from an epic battle. I am childhood.